Chapter 24, Dissociative Disorders. Self-concept is considered the frame of reference through which people view the world. It is the sum of 5 different components: body image, self-esteem, self-ideal, personal identity, and role performances. Body image are attitudes and feelings about one's own body. Self-esteem is the judgment of one's own self-worth. Self-ideal are personal standards of how one should behave. Personal identity is behavioral traits and characteristics by which one is recognized as an individual. And role performances are socially expected behavioral patterns. All of these different parts of an individual fuse together and blend over time into the unique characteristics called self-concept. As self-concept develops over time, small fluctuations are normal based on life experiences. People who have developed healthy personalities have learned effective coping and social skills that can help them deal with life's challenges, and these individuals are said to be resilient. Mental health problems arise when these skills are not learned, and negative, self-defeating behaviors become the coping mechanisms. Toddlers need consistent behavior from their parents because they test their parents' limits. While they're learning what is acceptable and what is not acceptable, positive reinforcement encourages the development of a healthy self-concept. School-age children learn the limits of acceptable behavior with the addition of new rules and limitations outside of their home environment. Consistency from parents and teachers becomes important. Children that are bullied at school can begin to develop a negative self-concept. By early teen years, the comfortable self-concept of childhood is now challenged. As the adolescent matures, they begin to develop a more complex picture of themselves. Self-concept becomes more individual, based on one's special characteristics rather than similarities that are shared by others. Thinking becomes more abstract, and self-reflection is needed to digest all of the physical, emotional, and social changes. Choices in careers and relationships are related in terms of where an adult falls on the continuum of self-concept responses. Decreased productivity and independence, failing health, and the death of loved ones can challenge how an individual has defined themselves throughout their life. Disassociation is a coping mechanism. It can range from normal behaviors like daydreaming to extreme behaviors that interfere with daily activities and then progress to a mental disorder. Dissociative disorders are classified by the Diagnostic and Statistical Manual of Mental Disorders into several types: depersonalization or derealization disorder, dissociative amnesia, dissociative identity disorder, and other dissociative disorders. If the problem lies with memory or consciousness, then amnesia or fugue, the inability to remember important personal events, results. If the disturbance is with one's identity, parts of the self will assume separate identities, and a dissociative identity disorder or a multiple personality disorder is diagnosed. Depersonalization is a response to severe anxiety that is associated with blocking of awareness and a fading of reality. During an episode of depersonalization, the individual feels detached or unconnected to the self. Individuals will often describe their experiences as watching themselves in a movie or floating above their bodies. An inability to put all of the pieces together can be very frustrating and even frightening for individuals that suffer from dissociative amnesia. Dissociative fugue is rare. Sudden travel with the inability to recall the past occurs as a response to an overwhelming stressor, behaves normally during travel but then becomes confused about their own identity, and the individual may assume a new life. A client will often have no memory of the trance, especially when they experience a possession trance. Possession trances will involve the appearance of one or more distinct identities that direct the individual to perform complex behaviors and activities, like culturally appropriate conversations, gestures, or facial expressions. For dissociative identity disorder, there may be the presence of two or more distinct personalities who control the individual. They can be related to extreme childhood trauma. The individual may or may not be aware of the other personalities, and this is often associated with post-traumatic stress disorder. The stages of treatment for a dissociative disorder relate to assessment, stabilization, and reworking through past traumas. The main goal of treatment for individuals with dissociative disorders is, with time, patience, and hard work, they will eventually begin to integrate or combine the personalities into a unique individual that is able to cope effectively with their own life stressors. As a nurse, we want to assess the patient's behaviors, the way they communicate, their social functioning. Our diagnoses are related to their own self-concept, the responses that they have, and then depend on their own identified problems. Contracts and agreements between the client and staff help both parties to develop trust in the therapeutic relationship and the environment. After trust has been established, interventions are directed at helping them examine the situations and related feelings within an environment of safety and support. This assists the growth of personal insight, which is the first step toward making behavioral changes.